Good evening, welcome and Sairam to our mental health talk today called Post-COVID Psychological Effects for Children and Adults. The talk will be conducted by Dr. Sabbitan Balakrishnan. All right, without further ado, let me introduce to you who Dr. Sabbitan Balakrishnan is. But prior to that, let's just look at some of the friendly reminders that we have to share with all of you. So, hold on now. Can you guys see my screen?
Yeah, but you need to share the slide.
Yeah, hold on now. Just I don't know what's happening. Hold on.
I can share, sister.
Can you
Yeah.
see now?
Yes.
Okay, so let's just look at the friendly reminders that we have here for today. Just 1 second, technical error. Okay, so here are some guidelines and reminders to keep in mind. Kindly mute your mic after joining the call. I think most of you have done so. Feel free to type your questions in the chat box, and also feel free to type your questions on the Mentimeter link posted on the chat box. You will remain anonymous. Okay, so if you have any questions, you may not need to wait till the end. You can just keep the questions coming in. You post it on the Mentimeter link, and we will collate all the questions and we will share it with the doctor at the end of the talk. All right. So now let's go to the next slide. Yeah, this will be the Mentimeter link. You just have to type in your short answer here and hit the submit button. Okay, so now post-COVID psychological effects for children and adults. So we all have mental health. We may need different things in order to feel physically healthy. And so we may also need different things to make us mentally healthy. So with us here today is Dr. Sabbitan Balakrishnan, who will conduct this talk. And before that, just a small introduction on who we are. We are the Satisai International Organization of Malaysia, and I'm representing SSBC Bandar Klang from the Mahila Wing, who we have put together this talk today. And Dr. Sabbitan is back with us here after 6 months. He first conducted a talk for us in September last year, and he's back here because the first talk that he conducted was so inspiring, so knowledgeable, and we had so many questions from adults, from every walks of life who really wanted to know more about mental health. Okay, so now let me just introduce to you our speaker. Dr. Sabbitan Balakrishnan is a medical doctor at the Child and Adolescent Psychiatry Clinic in Hospital Permai JB, and currently doing his master's in clinical psychiatry at University Putra, Malaysia. He has had many experiences, guest speaker on creating awareness on mental health related issues for multiple government agencies in Wilayah Persekutuan Labuan. He has delivered multiple talks on quit smoking strategies and breaking addictive patterns, also working actively in managing COVID patients in Hospital Permai JB and actively involved in providing psychological first aid. His special interest is in mindfulness meditation. He's trained by Oxford Mindfulness Center. It's still ongoing. Addiction and behavioral modification counseling, integrative medicine in enhancing mental well-being, as well as a certified psychological first aid therapist. Okay, so without further ado, let's have Dr. Sabbitan with us. And if you have any questions, you can always share it and to Dr. Sabbitan Balakrishnan on his email address here, and we will also post this later. All right. So I will show you all a small video now before Dr. Sabbitan comes on. Okay, just hold on. Ooh, some small error. Mohan, can you share the video?
Man, when I look at that kid, it's hard to believe that that was actually me. I definitely struggled through that time. I was so angry, felt so alone. It was so hard to make friends. But to tell you the truth, I probably wasn't much fun to be around. I definitely found schoolwork so much harder than most people. Every year I struggled and it just felt like it was harder and harder to keep up. And there were people, they tried to reach out to me, and I wasn't very nice to them. I just lost control. I just felt so isolated. Yeah, things started to change when I hit year 5. You know, my teacher, she just made such a difference. I knew she liked me even though she pulled me up when I did something wrong. She was always happy towards me and smiling and showed an interest in me. She definitely noticed that I needed something extra than the other kids. So, my teacher ended up calling my parents. She got us booked in with the counsellor, who really listened and got my parents and teacher to understand what was going on with me. Yeah, I don't know what would have happened if my teacher hadn't stepped in when she did. The counsellor was cool. She gave my parents advice on how to help me and spend more time with me and things like that. She was also just a massive help for me too. I was calmer, and hey, I even made some friends. She gave me some ideas on how to manage my feelings and just make better choices. And it worked. It was such a battle up to that point, and things they could have turned out very differently if it wasn't for my teacher. What changed things was someone noticing and taking that extra step to find the right help for me.
Hi Ram, let me just share my screen now. Saram, dear brothers and sisters, thank you so much for having me here again. I am delighted and thankful for the invitation once again, and for the wonderful introduction given by Sister Sajita just now. I feel so humble, and I would like to express my gratitude to our Divine Master. My humble pranams at his lotus feet of our beloved Bhagavan, Sri Sathya Sai Baba. We are all here gathered today because of him and his presence, and I ask for his presence to be with us throughout the entire presentation today. So today we will be covering a few things. I believe that in the past we have covered major mental illnesses and how the COVID can actually affect us. And it has been almost 2 years now, from 2019 till 2022, and there are a lot of things which have taken place in the past. So this presentation will not be redundant in the sense that we will not cover things that we have covered in the past, but we will go through things that the psychological effects of COVID, which had taken place after a longer period of observation, right? And then we will cover specific target groups such as children, adults, and also I would like to take this opportunity to address all those healthcare workers, our SAI healthcare workers who have been fighting really hard against COVID, and we will address them as well, and we should be supportive of their endeavors as well. And finally, I think the most interesting part for after a very long, tiring day, we will wrap up, and then I will send each and every one of you with one practice that you can do on a daily basis, which can actually improve and empower your mental health. So without further ado, let me start off by sharing what does mental illness mean. A lot of you might be thinking there can be a lot of people out there with different definitions of mental health, mental illness to say. So from our perspective, from the mental health perspective, when we say some mental illness, we mean that there is a mental health condition which has caused some negative consequences. And how do we know these negative consequences? Because naturally, when we look at people, it's a bit difficult for us to identify if they have any mental illness just by looking at them. So that's why it is very important for us to speak to them and to really observe what is going on. So usually people who have mental illness or those who are suffering from mental illness, they have a very difficult or different thinking pattern. They tend to ruminate on matters excessively, or sometimes they catastrophize, meaning that something which is small, they ruminate, they think about it to an extent that they get affected by it. Now, this can also translate into their feelings. Sometimes they have very intense emotions, such as feeling sad, feeling depressed, and also feeling too anxious to begin with. And this will translate into their behavior. So they may exhibit behavior, and this is what we need to observe, the behaviors. And then if there are any abnormalities in their behaviors, this is something that we can note, and then perhaps we can be more mindful of behavioral change in our colleagues, in our family members, and also people around. Now, so it's almost 1 to 2 years already, and what are the long-term effects of COVID? So there are a lot of research going on COVID, and yes, there are multiple research done on the physical effects of COVID, like how it can affect your heart, how it can affect your lung, and what are the reversible effects of COVID to the lung, to the heart, to other systems in your body as well. However, there are also long-term psychological effects due to COVID. And today we will go through the long-term psychological effects. If you look at the statistics over here, right? Sorry. So if you look here, you can see that the younger people were hardest hit, especially with major depressive disorders and anxiety disorders. So we notice that the younger generation has been affected tremendously in terms of their emotional well-being. Either they become too depressed, or they in view of the uncertainty that we are faced with, they become too anxious, right? So, and these actually are prevalent more among females compared to males, as you can see here. Now, so what are the symptoms that you can see? In one study, there is a where they actually measured the symptoms of the COVID, the psychological effect of COVID, and they found out that in the hospital, those who were admitted, at least 22% of them develop anxiety. And those who were admitted in ICU, I know of a lot of us, especially among our Sai brothers and sisters who have been admitted to the ICU setting in the initial stages before we were vaccinated. And they actually ended up having depression and other mental illnesses as well. So the other symptoms which can be associated to this, according to the study, is that they tend to have confusion, in the sense that they have this brain fogginess. They tend to not be alert all the time. There's always mental confusion. They have difficulty in sleeping, and they have difficulty in memory retention, and also poor concentration. So this can translate into forgetfulness. Those of you who have been affected by COVID in the past and who are having these symptoms, it is good for you to be aware. And if you aren't aware, then maybe from this presentation, if you're having these symptoms, then it is time for you to ask for help. Those who actually go through critical illness to an extent that they need to be intubated and so on, what happens is that due to the traumatic experience, they develop PTSD. PTSD is post-traumatic stress disorder. So this post-traumatic stress disorder, they have it comprises of an array of mental symptoms, including feeling hypervigilant, meaning too anxious to an extent that you feel very restless, the inability to stay put at one place, frequent flashbacks about the hospital stay or ICU stay, or while you were admitted in the hospital. So these are all symptoms of PTSD, and difficulty in sleeping as well, and then difficulty in processing the trauma. There can be a lot of effect, especially if you have permanent lung damage or irreversible lung damage. So it's good for you to know this and how it can affect your mental illness. Now, there are multiple studies which have been among the adults, which had been carried out, especially in China, because the COVID started off there. And they found out that 29% of the general population who were affected with COVID developed moderate to severe anxiety. And about 17% of them actually developed depression, and 32% of them increase in alcohol consumption, and almost 20% of them actually relapse in alcohol abuse. So this is a common pattern that we have been observing, and I have mentioned this in the past as well. Substance abuse, when people find it difficult to cope, they end up coping by um, uh, inhaling or taking substances so that they lose their body consciousness, or even they prefer it that way because the suffering that they are experiencing at the present moment is too hard for them to bear, to an extent that they need an altered mental status by consuming alcohol or any of these substances in order for them to cope. It gives them a temporary relief, but it is in fact suffering, to be honest, on a long term, and even in short periods of use. Now, when you look at Canada, they also studied the effects of COVID, the psychological effect, and they found out that 36% of them ended up having serious mental health conditions such as depression, schizophrenia, bipolar mood disorder as well. So this is due to could be possibly due to the social distancing as well. And because of the social distancing, significant toll has been taken on the mental health of our population, because we are used to socializing, we are used to talking to our family members, especially in our joint families and even with our friends. And the moment this pandemic hit us and we are all forced into a state of physical isolation, what happens is that the distancing becomes an issue and we are unable to meet people face to face. And then this is an adjustment for each and every one of us. So the advice to the general public is always to stay connected. Okay, always have frequent video calls, and then sometimes if you have friends or family members who are of the same age, always have virtual games. There are a lot of online games that you can play, and you can stay, though you are physically distanced among yourselves, but you can still be connected through regular video calls and online games. If there's a necessary quarantine, then you should get proper advice on quarantine, to an extent, to know and to be aware of why you are being quarantined in the first place, how long you're being quarantined, and what are the do and don'ts if you're quarantined. So don't end up being in a situation where you feel lost. So that is what we don't want from the health perspective. You must always be informed. And if you are aware of people going through this, please inform them that you are being quarantined for so and so because of this reason. If they feel lost and if you are unable to give the proper information on why they're being quarantined and what is the purpose behind it, then you should direct them to the PKD or the nearby quarantine center so that they are more aware of what's happening, right? Now, the healthcare providers are a group of people who have been affected tremendously throughout the entire pandemic. And even now, though we are downsizing, downscaling the entire operation of COVID, the response to COVID, and we have started to change our approach from an acute to more of a maintenance phase. So the reason why they are affected, if there are any healthcare workers, and I'm very sure there are healthcare workers among us today, or if not, I'm very sure you know of healthcare workers, nurses, medical assistants, doctors, even PPKs or other medical professionals who work in the environment, psychologists, for instance. So they have a lot of direct contact with patients, and they are frequently being quarantined. So I know that I know a few of my friends who have lost their spouses because of COVID. I know a few of my friends who have been quarantined in and out almost every other week. So you're just out of quarantine and then you get exposed again and then you're quarantined again. So the period where we were at a very beginning during the pandemic, it is a very difficult period because at that time we weren't very sure. There were a lot of uncertainties. But right now things are getting more settled down. So we know how we can best address the situation. Now, so this translates into increased social stigma. Even today, I was having a conversation with a very close colleague of mine, and she just came out of quarantine because her husband was positive and all her children became positive. So she was quarantined, and then she told me that Sabi, the problem is, though I advocate for anti-stigma, even I feel stigmatized. Even working in an environment where we are anti-stigma, but we still feel the social stigma is prevalent. Sorry, I think I was muted. Okay, so let me continue. So this is due to no clear communication from superiors as well. So if you are in a leading position in your company, if you are a leader in your family, I'm very sure there are leaders here, not necessarily leader in organization, can be leader in any perspective. So the role, if you're playing a leader role, so it is very important to recognize that people can be at a particular risk, not necessarily only healthcare workers. It can be any of your colleagues, it can be any of the people working under your firm, organization, or under your leadership. So if they are having any issues regarding COVID and they have been quarantined, you have to be aware that there is a tendency for them to be affected by mental illnesses. So trying to be less judgmental, be more in an acceptance mood, accept them and provide them with the love and support that they need. And this is the best that you can do for them. Okay, so this is another representation of the type of illnesses that the healthcare workers are actually going through. Studies conducted in Australia and also Canada shows that a lot of them have anxiety, PTSD, as I've mentioned just now. They have frequent flashbacks and traumatizing sensations in the body, which is very, very difficult for them to process. And then this translates into them having poor sleep, and also a lot of them need psychological support. So now let's move on to children. What we found out from a prolonged study on children is that because of this pandemic, a lot of them develop anxiety, depression, and insomnia. So when we say anxiety, they tend to be very restless, they tend to be very fidgety, they can't concentrate, their attention is fleeting all over the place, and you notice them being hyperactive, right? And then depressed in the sense that they can be very irritable, they can be very agitated, they're not being the same, and this can translate into them not having proper sleep. Okay, this is due to actually the disruption in their routines and the closure of the school. So children are used to socialize with their friends, and if we reflect on our childhood, most of the time we were in contact with other friends, other classmates, and we were able to have a social connection, social interaction with them without being abrupted. And the current generation, they are hit tremendously because of the closure of the school. They can't see their friends. Despite having a virtual classroom, it is never the same. And we know how it is when we are in the office and having the same meeting at office and having the meeting virtually. It's very different. The energy, the vibe, your friends, the jokes, the ambience, it's very different. So because of this disruption, closure of school, the inability to see friends, and exposure to concerning stories, like a lot of them, there are a lot of propaganda, or a lot of stories, fake news, or which are spread through WhatsApp and other social media. So these have translated to them in increased screen time. So what they do is that either directly or indirectly, they tend to be more focused on their screen. Is it because we're not sure? Is it because directly due to the movement restriction, parents are being overprotective? We don't want our children to go out of the house to mingle with people because we are unsure, we are uncertain about the virus and what it can do. And then children, at one point, they weren't vaccinated. So the fear is always there. And due to this, as I mentioned, either directly or indirectly, they tend to spend more time on their screen. So this has caused a lot of difficulties, as well as because we know that a lot of screen time can also mean physical and also mental health effects as well. Now, this is a data which which is available to the public. And if you look at this, in the year January 2021, we actually the average Malaysian spends 9 hours, 17 minutes on all devices, right? And then 2 hours, 55 minutes on just broadcast and streaming, and 3 hours just spent on social media. We're talking about average citizens here from age 16 to 64, right? And if you look at the most used social media platform, number one is YouTube, WhatsApp. I'm not saying that the social media is at all time wrong. No, I'm not saying that. We know that social medias actually raise a lot of awareness, especially regarding physical health, mental health, politics, and world life events, right? So social media is good to a certain extent, but having said that, it is a tool, and it is at our discretion on how we choose to use the social media, right? A lot of people get addicted to social media. If you want to take this a step further, you can go through how the teams of the social media, they use psychological hacking. So psychological hacking is a pattern that they have used to psychologically hack every user who uses the social media application, so that you stay hooked on it. A very good example is the like button, right? The like button is a form of psychological hacking. When you are on Facebook or YouTube, do you see how much of emphasis is spent on the like button? Because whenever you say like, when you click like, what happens is that from a psychological point, you feel happy, especially when your photos, there are many likes, like 70 likes on your photo. You feel, wow, I feel good. There's a sense of elation in your mood. However, when there's a lot of dislike, when there's less likes, what happens is that you feel demotivated. You feel like, okay, why am I not getting enough likes? And then this results to you deleting your post, changing your post, rewording your statuses. So these are all forms of the reactions that the way you react to that particular situation is due to the psychological hacking which was placed in the application itself. So that is why it is very, very important for parents and for also children and adolescents to be aware of this. Whether what are the effects, if you are aware of the screen time. Most phones right now, smartphones, you are able to monitor your screen time. So if you see there is an excess in screen time for the past maybe 1 week, 2 weeks, or so and so forth, then you should reflect and ask yourself, why is there an excess in screen time? And then try to limit your screen time. Try to limit for beneficial users only, and social users in connecting to people, not unnecessarily just going through this. Now, if you look at the mobile app ranking, Facebook and WhatsApp is still first. And then in terms of games, I know many people play Candy Crush and PUBG and other, if you look at this table, there are other types of games as well. So people are actually hooked on to social media. Another thing that I would like to bring forth here is how videos in YouTube, right? Videos in YouTube actually psychologically hack us as well. This is something that we need to be really mindful about. If you look at the screen of the videos, right? A lot of these videos circulating among children nowadays. If you look at the screen changes every 2 to 3 seconds. So what this does is like when these children videos, one screen move to a next screen. Moving to a next screen means like maybe the first screen is like a child talking to another child. Then immediately there's another screen where the child goes to meet his dog, and then there's another screen. So the screen changes. The screen changes every 2 to 3 seconds, or maybe less than 5 seconds screen. So what happens on a prolonged period of time is that children nowadays will have attention deficit, because we are actually exposing them to videos which don't enhance their attention and concentration, but reduce their attention and concentration span. So be really mindful of this. I've seen a lot of my cousins, they show these kind of videos to their children and they're hooked on it. I'm not sure why children are very hooked on these videos, but the long-term effect is we are training them to have shorter attention span and not longer attention span. And this can translate into them having poor grades and especially losing interest in study at a very later stage that we will see. So younger children, due to their limited understanding, this you're talking about preschool, limited understanding of the pandemic and limited coping and communication skills, because the authority is very much dependent on their parents, right? So younger children, preschooling, they don't have much authority, and their problems, how do we know they are actually going through psychological problems because of their deviant behaviors, right? They tend to be very naughty at home, when you tell them something, they don't listen. And then this is something new. It is not something, their temperament is not a sudden change. This is something that, this is not, the temperament is not something for a prolonged period. The temperament is something sudden. So this is something observable, and they become very irritable. They start to become fretful in the house, crying all the time. As I mentioned, reduced attention span. It could be due to the prolonged gadget use. It could be due to COVID itself, right? And then the other thing is developmental regression. We see younger children, they end up, they like to regress in the sense that they start sucking their thumb. So these are all things that babies do. So when we say developmental regression, we mean that preschool children regress to newborns or maybe infants, and then they exhibit tendencies of infants such as sucking of their thumb, crying unnecessarily, those kind of things. So what can we do to solve this problem? Number one is we have to increase our time with them. I understand that a lot of us are working from home now, and if you are working from home, I guess that you can find time to be with your children. Show them that you love them, provide them with the support and the affection that they need. Try your level best to have screen time at home, because this is really, really something that we are emphasizing on, especially in the Western countries. A lot of surveys have been done, a lot of studies have been done to show that prolonged exposure to social media causes a lot of mental health issues. So it is really important for us as a generation to rise beyond this problem and identify, be really conscious about the amount of time that we expose our children or loved one to social media and the media, to be exact. Try to reduce pandemic discussion among very young children, because their tendencies to process this cognitively, the tendencies to process what's happening is at a lower level compared to adults. So don't have pandemic related discussion to stir up anxiety among them. Try to prevent it and create a safer environment for them, right? And then encourage video chat with relatives and grandparents. So this is really good to actually connect to the elderly, and especially the young ones and the elderly. So this is a way how we can help the younger children to cope with their uncertainties. Now, a lot of children have been quarantined as well, and we found out that almost 30% of them develop a chance to experiencing PTSD. We were having flashbacks, as I mentioned, a lot of nightmares, difficulty in sleeping. So how we can prevent this is to have regular contact with their parents, especially when they're quarantined, and then continue their daily routine. If they have a routine at home, they play games with a group of friends, then let them do so. It's completely fine, because they are quarantined away from their family members. And then if you notice any behavioral change or mental health change, it is wise for you to direct them to a mental health professional. Now, let's look at the group a bit. Adolescents, let's say from Form 1, from 13 years old all the way to 17, right? So these people are disproportionately affected by social distancing, because this is the time that they want to go out with friends, watch movie in the cinema, right? So they have what happens is that because they can't go out, their energy level seems to rise because of the restlessness that they are faced with, and then they have an increased desire for new experiences. We call this novelty seeking behavior, in the sense that they want to try um, new experiences such as smoking. They want to try new experiences like consuming alcohol. They want to try new experiences like, driving recklessly or merempet with people. I have a lot of parents tell me that, especially when I was in Johor, that they notice a lot of risk-taking behaviors from their children, right? And then they crave social interaction with their peers, because that is what they are lacking of at this the current moment. So this leads them to feeling bored, frustrated, and also isolated. The solution to this is very simple: have regular video calls with friends and family. Try to incorporate a daily exercise activity outside. It is completely fine for you to have a walk outside, or even jogging early in the morning. Pick times where there are not many people on the street, just to be safe. If you have elderly at home, right? Avoid frequent long naps. Avoid screen time before bed, because what happens is that the blue ray from the screen keeps your mind active, even though even though you feel that you're sleeping, your mind is still active. So this results to you not having a deep sleep, right? So when you look at sleep from a mental health perspective, there are waves, right? There are waves that our brain is, and for us to have deep sleep, we need to go into theta waves or delta waves, which are very deep sleep. And somehow or rather, because of our prolonged use of uh, prolonged exposure, sorry, to gadgets, what happens is, especially first 1 to 2 hours prior to you hitting, prior to you sleeping, despite you closing your eyes, there's mental lethargy, physical lethargy, and you want to just sleep it off, but your mind is still active because of the blue rays emitted from your screen. So this is something for you to be really, really, really mindful of. Those people who come to my clinic because of insomnia, insomnia means difficulty in sleeping or maintaining sleep or initiating sleep, anything regarding to sleep. So this is due to that. Just try to stop using your gadgets off time, at least 1 to 2 hours before sleep. Okay, gadgets. Now, this is a video that I would like to share with you. Okay, so I think the video very nicely actually summarized what we have talked about when it refers to children, right? So what are the symptoms? What are the signs? How we can reduce this as well? Um, so there are other things that we should also be attentive about, be perhaps mindful of. Number one is a lot of domestic violence has been increasing, a lot of neglect happening, and a lot of children being exploited as well. Physical abuse, emotional abuse by their own family members, by relatives, things like that. So we in certain countries, especially in Malaysia, we noticed that there are over 300% increase in domestic violence in certain countries. Even in Malaysia, the percentage is almost equal. And it is important for us to understand what is going through, and it is important for us to be aware and be aware of people who are going through similar situations, and then direct them to the necessary authorities. Now, we should also be aware that not only children get stressed, parents also get stressed. So when parents get stressed, it is important for you to be in charge of your mental health, to take care of yourself. If you know that you are having a difficult time, you know that it has been quite some time, almost 2 to 3 weeks, and then you feel really down, you should go and seek for help. I understand the stigma is very high in our community, especially the Indian, Chinese, the Malaysian community to be exact. We tend to disregard our emotions, and we think that it is something we can just completely ignore. But well, look around. Every 40 seconds, there's one of our brother or sister who is taking his or her life every 40 seconds. So throughout this presentation, you can do the math. How many people has taken their life already? So this is a crucial awareness that I'm trying to inculcate. I'm trying to bring forth to everyone today, right? So using supportive language, getting in touch with supportive group, and also suggest coping strategies can actually help out. So I will skip this part, sorry. So I would also like to advocate on the suicide cases that I mentioned before. If you know people who are going through a difficult period of time, so maybe you might want to talk to them about it, identify their feelings. If you are going through this, right, if you look at the feeling section here, you feel empty, hopeless, trapped, or having no reason to live, you feel extremely sad, more anxious, agitated, unbearable emotion or physical pain that you're going through. So, and then if you notice that your family members have changing behaviors, such as they're making plan or researching on ways to die, and then they suddenly socially isolated themselves, and then taking dangerous risks, and then displaying extreme mood swings, the sleep and the appetite also reduces, so using drugs or alcohol more than often. So these are all things that we can be aware of, and then direct them to a mental health facility. Firstly, you might want to sit and talk to them if it's your family members, but if it is beyond what you can handle, then don't worry. Later I will share a slide where you can take a photo, and then subsequently you can use the necessary directions from that slide for you to advocate mental health, right? So what can we do about this? We're reaching the end of our presentation. It is important for us to get regular exercise, and then talk with our colleagues, try to stay connected. Well, physical distancing does not necessarily mean social distancing, right? It's just physical. Socially, we can still be connected. If you have not started meditation, please find time to meditate. There are a lot of avenues out there how you can learn meditation. I am a very strong believer in meditation. We are actually having our first cohort among our Sai brothers and sisters. We have 22 of them who are actually learning meditation right now, and we are doing it over a period of 2 months. So I've seen a lot of improvement in them, a lot of challenges which they weren't able to go through, and then right now they're able to sit down and meditate, and that is a very good thing. I'm hoping that we can expand these meditation classes so others may also benefit from this. So if you have time, you can also visit the Satisai organization website, international organization website, in the section of well-being, so you know that these are the avenues how you can take charge of your mental health. Eating healthily is something that I'm very, very passionate about as well. Um, be very be aware or be conscious of the nutritious value of the food that you put in, because if you come to think of it, your body, your mind, everything is basically what you eat. If you don't eat for 1 week, if you don't take anything, don't drink, don't eat for 1 week, you will not exist on this planet as well. So I mean, your body and your mind will no longer exist. However, it is, if you really, really pay attention to your food, pay attention to exercise, pay attention to helping and supporting others, engaging in spiritual practices. Like there are a lot of online spiritual sadhanas that you can actually engage in, right? And then if you're finding it very stressful, as I mentioned just now, you can use the similar methods, right? Like eating healthy, getting enough sleep, setting your priorities, right? Especially when you have too many things, you must know which is A, B, C, D, which is first, which is second, which is third. And then it is time for you to find a way how to relax, right? It's either via music therapy, listening to music, or yoga, meditation, mindfulness, it could be anything. Okay, and the reason why we don't want to seek help, most of it is because we are unsure where to seek help. Hopefully I can target the 56% of people who don't know where to seek help, and the others is mainly due to stigma and also embarrassment. So today I'm going to teach you one technique which I do every day, and which I hope all of you can do as well, because this technique liberates your mind. Okay, it liberates your mind in the sense that when you practice gratitude, what happens is that your mind takes on a different perspective at life on a daily basis. So every day before you sleep, right, every day before you sleep, you can do it either the first thing you wake up or before you sleep. Best to do before you sleep, because you want to show gratitude and take time to express your gratitude and find 10 things. It can be people, it can be person, it can be swami, it can be a weather, it can be the car, it can be circumstances, it can be anything. So the first few days, it's going to be a bit difficult. You know, first few days you may only be able to give like three. You can only express gratitude for three things, right? Don't be discouraged. Persevere. So maybe after a week, you'll be able to go up to 5 things to show gratitude. Then by the end of the month, you should be able to show gratitude for at least 10 things which you notice in your day, and you are thankful that these things actually happen, right? So if you have a mobile device next to you, or if you're using your laptop, please print screen or screenshot this slide. If you know anyone who is going through mental health issues as well, please just screenshot this slide, or take a photo of the slide, or whichever way is convenient for you. And then if you look at this slide, there are a lot of avenues where you can directly call, or you can also use the QR code scanner to find out the psychiatric services available nearby you, the clinic kesihatan nearby you. These are all government agencies that are willing to listen to you, that are willing to offer help. So these are my references. This last quote that I like to share, this is one of my personal favorites, is when Swami says, walk beside me and be my friend. He really means it. He really, really, really means it. And his presence, I always feel his presence with me every day, because I really believe that he's always there with me. So if you know Swami is there, if your conviction is 100%, he's always there with you, there is no such thing as loneliness. You will never feel isolated. You will never feel lonely. You will never feel left alone. You will never feel that people don't love you, because he's always there within you, guiding you all the time, above you, below you, side, anywhere. He is always there. So this is something that I want to since this is a spiritual talk and we are all brothers and sisters, and our divine master is of the same, so I would really urge each and every one of you to take this special opportunity to be friends with Swami. If your friends are 80%, make him 100% friend. Let him be the internal voice which commands. Let him be the ultimate guidance. So most of the mental illnesses will not even come close to us, because we have Swami with us. We spend time contemplating on him and his messages. With that, I would like to invite questions. Thank you, Sarah.
Thank you so much, Doctor, for the excellent sharing, advice, and solutions, and all the quick tips that you gave us. I'm a parent myself, can relate to so many points that you presented. I like the point on reducing the
Screen time.
information that we share with children,
Okay.
on the pandemic, because
Yeah.
kids today, they're so observant. They are more well informed than us adults. They seem to know the numbers even better than us. Like, we have them following the daily
Yes.
numbers. Right.
Yes.
Thanks, Doctor. So, so we have about, I think, 6 questions for the doctor. So I'll just go through the first one. Good evening, Doctor. The overfed information on the cases, suffering, death, and related subconsciously affects us. How to stay healthy minded in managing with good immune and attitude in defeating the COVID effect. There are many questions in this one question, so maybe you can dissect it.
Okay. So the answer is very simple. The answer is very simple. Can you change the information? Can you change the cases? Can you change the suffering? Can you change the death? You cannot.
Right.
Accept that first. If you cannot, like what Swami says, what is the shape of worry? Swami says, what is the shape of worry? Where is the worry? Show me the worry. You cannot show me. So the worry is non-existent. It's just in your mind. So if it's just within yourself, in your mind, so what you do can actually help you out. Meaning that you can still take control of the situation. It is not outside of you. It is within you only, right? So exercising, eating healthily, and then spending time in relaxation or relaxing techniques, yoga, meditation, spiritual sadhana is very important. Connecting with Swami, either to whatever sadhana you choose, any marga that you choose, bhakti marga, dhyana, anything, whatever you are more inclined to, whatever it is, just don't let the society judge how you connect with God. How you connect to Swami, it's something very, very, very personal. So cherish that connection, and I'm very sure your immune system will boost out, your attitude will completely change. Practice gratitude. Despite hearing all this negativity come on a daily basis, practice gratitude. Train your mind to see the good in every situation. Train your mind to be thankful of every situation. And then after a period, 1 month of practicing the 10 fingers of gratitude, you will realize that, oh, my mind can do this. All this while I was not aware of this. Suddenly I am more thankful, and there will be something that will open within your chest. I mean, within your chest cavity, in your heart, you will feel there's this opening which will happen, and there are a lot of positive emotions that will surface from that. I hope
Right.
it answers.
Let me just add on to your 10 finger gratitude. So how long did it take you, Doctor, to actually practice this? Maybe you can share that with us, question over question.
So I have been doing gratitude for a very long time. My gratitude practice is a daily practice I do early in the morning. Because I do Jyoti meditation. So Jyoti actually incorporates a lot of gratitude to your family members, to everybody, your teachers, to your colleagues at work. So Jyoti is really gratitude. But when I do 10 in the night, it took me first, maybe it took me 1 week to be able to see 10. Then sometimes if you do it for a very long period of time, you become it is not 10. What happens is that every one becomes very meaningful. That means when you thank Swami itself, you'll have 100 things to thank Swami for the day. When you thank your parents, you'll have 100 things to thank about your parents. Before you know it, you won't have time to do 10 already.
Right.
Because your mind is so, thankful to a lot of things. You just need to realize it. That's all.
Right, right. Doctor, just to give you an insight on
Yeah.
the participants we have today,
Yeah.
we
Yeah.
have many who are also not from the Psi fraternity. So
Oh,
perhaps you want to also, say
okay.
a few words to them. We have sisters, sorry, I'm trying to get the names here. Zaliha Mustafa, and then we
Okay.
have, okay, just to let you know.
Okay.
Right.
Okay. Okay.
Okay, so let's go to the
So
second.
the point is,
Yep.
sister, just let me
Sure, sure.
address them. So regardless of religion, regardless of spiritual practice, your connection to your God, to your religion is very unique to you.
Perfect. Yeah.
Okay, not necessarily religion, but your spiritual practice.
Right.
Okay, so connect within to your God, and regardless of it, it doesn't matter. Names and forms are very different.
Yeah,
Okay.
beautifully
Yeah.
put. Yes. Okay, so we'll move on to the second one.
Yes.
Are we in a biological war and impairing natural immunity by keep injecting short tested vaccine after vaccine? Okay, doctor, you have to answer this as a scientist now. Isn't it good to have more education in living a good balanced diet with all the natural immunity? Okay, again, a few questions in one. So,
okay, so I'll try to make it very
right.
concise.
Okay.
Yes, I agree that the research done on the vaccines are not long-term, short-term, because we were faced with a global pandemic, a global issue which we needed to address. So we reduced the time that we would normally use to finding out about long-term effects of the vaccine, like the current vaccines that we already have prior to COVID. But we needed to really hasten the entire process because there is a global crisis here. A lot of people are dying. So in view of that, I do agree more research should be done, right? But having said that, look at the outcomes. Look at the outcome of vaccine. The number of COVID centers have reduced now to almost, we have shut down most of our quarantine centers, 70% reduction at least of our quarantine centers. ICU beds are no longer being occupied like those days. Respiratory machines, those days, the anesthesiologists need to make decisions who to give the machine, who not to give machine.
Right.
Because the cases were so high, we couldn't control. Now, because of the vaccine, we are able to see the effect either directly or indirectly. We're not sure, but what we are sure is that what we can observe with our eyes is that the number of admissions to the ICU have reduced. The cases of severe illness has reduced. So if we are going to dismiss all of it and just wait for natural immunity to work, is this a risk that you are willing to take? From the medical perspective, I don't think this is a risk that I am willing to take, and I'm willing to put my children through. This is not something at this point of time. However, if you are living in a closed environment, closed area, like in certain parts of Brazil, where I have my cousins in Brazil who live in a closed community among the Hare Ram Hare Krishna people. So if everybody doesn't vaccinate and you don't have contact with the external world, with people outside, and you just survive on your own food and water and everything, no contact at all with other people, then it is a completely different scenario that we're talking about.
Right, right. Yeah, I always believe the numbers don't lie, right? As well, as long as the benefits outweighs the risk, then I think we should all protect ourselves. Okay, so that brings us to the third question, doctor. How do we help children who have school withdrawal symptoms after being away from school for almost more than a year? I think this is a very common thing happening.
Very challenging. Very challenging. I don't have children of my own, so my perspective of answering this question is from a doctor's perspective, as only from the clinic perspective, and what I advise my patients and their parents. Number one, you have to be stern. Okay, stern is very important. That means they should know that we are moving to a different phase of endemic, and then now there's a very high possibility schools are going to be open completely. You are most probably going to be in contact with your friends again. But at the same time, you must understand that these are a group of children who have been isolated not by their choice. Not by their choice. We can understand as adults, but children not necessarily they can understand. They might be blaming the world, blaming God, blaming everything around them for why do I need to stay isolated because of some virus? They don't even probably understand what are
Right.
the effects of the virus,
Mhm.
right? So we have to take all of that into account and be very supportive and very encouraging of the school, and try your level best to give them time to understand this. Provide, maybe start off by providing information first about school, trying to engage them with friends first, and then slowly move on to school.
Right. Yeah. So I think there is steps to take
Yes.
and to follow, right, Doctor? Huh?
Yeah. Yeah.
Okay. The next one here, I believe it's more of a statement, but you can comment further. I suggest the circulation of good information that prepares us from contracting any illness instead of giving fear factor that pollutes our mind.
Very true. What's the shape of fear? What is the shape of fear? No
Oh,
shape.
yeah.
It's just a feeling within, and who feels afraid? It's the ego which feels afraid. Okay, so this
Yeah.
is something that you really need to understand, and I really hope that we don't share unnecessary information, especially alongside children of the age where it's difficult for them to understand. Okay.
Right. Okay. So now the next one, we are spending more time at home and avoid to go out due to this pandemic, although we are not in quarantine. And I frequently feel moody or down. What can I do for dopamine boost? I thought serotonin first.
Straight away to
Yes.
dopamine.
Very good question. I like the thought-provoking
Very
question.
good question. Well, you know it's safe out there.
Right.
You know it's safe, right? You know it's safe. The next thing to do is reflect, why are you not going out? Right? You
Yep.
can you can take protective measures to go out. You can still exercise. There are a lot of people exercising. We have received 3 vaccines. Most of us are already
Yeah.
at a
Boosted.
booster. So why are you still at home? Right? So ask yourself that question. Are you taking time to adjust to this new change? Right? So we took
Right.
time to adjust from all the way out to staying at home. Then we adjusted. Now we can go out again, and then we feel like it's difficult for us to adjust again. So if this difficulty to adjust is the issue, then you should try your level best to push yourself out of this. If you're finding it, if you find this in a loved one around you, a friend or anyone, you should support the person, encourage the person to take charge of what's happening at that very moment, to come out of it and realize that things are improving. Things are at a better place now than when it was in the beginning, where it was in the beginning. And once you understand this, naturally you will be able to resume your activities. So once you resume your activity, your dopamine system will be regulated back again to how it was in the past. However, if you're looking for like excessive dopamine boost, maybe you can go to the if you have things which you have done in the past which actually stimulates you or makes you feel happy, you can continue doing that.
Right. Thanks, Doctor. So there's a last question here. I believe there's no questions on the chat box. Yeah. In a classroom environment where some of the children have got COVID before, is it a good practice to encourage these children to share about their experience while having COVID with their other classmates?
Let me just read this question again. In a
Sure.
classroom environment where some of the children have got COVID before, is it a good practice to encourage the children to share about their experience? Okay, this is very tricky. If the teacher is trained to handle this,
Right.
then by all means, okay. But if the teacher is not trained, it can get very nasty, very dangerous as well. Because children suddenly they may start crying, they
Right.
might go into hysteria, and hysteria, as you know, can spread because it's psychological hysteria,
Right.
right? So these are things that if the counselor is doing this, then
Yeah.
I think it's completely fine. But if it's a teacher who has no background in counseling or handling a breakdown, let's say if a child breaks down and suddenly a few other children are crying, if that is overwhelming to you, then I suggest that these should be kept with the professionals to handle.
Right. So I hope that answers all the questions that was posted today. Let me take a look at the chat box. I believe there's no questions, but perhaps a statement earlier during your talk, not only a healthy food, if possible, nice healthy food.
Oh yes, yes, yes. If it's not nice, why would you want to eat it, right? Like,
Right, right.
so yeah, nice healthy food. I agree.
Yeah, good one. Okay, doctor. So thank you so much. I believe there are
Thank
no
you
more
so much.
questions. If there
Yeah.
is, let me just do a last quick check on the Mentimeter link.
Meter.
Huh?
Mhm.
Let me just see. Just hold on now. Just one more. Yes, there's one last one. Good.
Okay.
Let me quickly read it. Good evening, doctor. In the event we are scheduled for another booster, are we allowed to decline? Is it advisable to take it or we can decline it?
Okay, you're putting me at a very difficult.
How to
um,
answer this?
okay, so since this is a public sharing, so I
Yeah.
have to be very, very, very mindful of what I say out here.
Yeah.
Okay, because I am a doctor and I work with the government.
Right.
Okay, so my
Right.
personal views and what I know of are very different things. But what I can offer you, if I were to put it in my words, would be uh, first, really know about why you're taking the booster. Okay, why? What's the reason? And then really go into the types of immunity and how it actually enhances your immunity and what are the side effects and if you're getting the same kind of vaccine or not, if there's a mix of vaccine between this and that, what are the effects. So these are things that you might want to venture a bit, spend more attention on, really going through the information. Don't get paranoid about it, but really be conscious about what they're trying to tell. If you're not sure, meet a friend of yours who work as a healthcare professional, or if you have a regular doctor, a GP, which you a family doctor who see, maybe you can discuss all this with them, and then ultimately it is your choice. It is your choice. Um, I'm really not sure of the SOPs, how is it going to be like. However, what I do know is that although I don't agree to how things are being carried out for those who don't receive vaccine, you should be able to face um, isolation or being alone if you don't take the vaccine,
Right.
because that is what is happening right now. The moment you don't take vaccine, you are not allowed to go to certain places. I don't agree with this, okay, but I guess from the government perspective, they are really trying to get people vaccinated
Yeah.
out there, so that on a holistic level we can move on economically and tackle other issues because of COVID, not just the health, but the economic breakdown and other sectors which are really affected because of COVID. Okay.
Yep.
I
All
hope
right.
that answers.
Yes, doctor. Thank you so much. I believe we have come to the end because there are no more questions and there are no questions on the chat box except for a thank you note. Thank you, Dr. Sabbitan. It is an interesting and useful sharing session, a lot of beneficial tips. Thank you for the good sharing. So with that, doctor, on behalf of the Satya Sai Baba Center Bandar Klang and all the participants here today, we'd really like to thank you. You're always truly remarkable as a doctor and professional that we really respect and trust. We call you back for the second talk, and I'm sure we'll be calling you back for the third and the fourth. So stay tuned with us, perhaps another 3 or 6 months down the road. All right. So with that,
Sure.
dear participants, we will share the recording with you once this talk is over. And I believe Dr. Sabbitan will be sharing some tips, right, doctor? Some handouts that we are going to share with the participants.
I think it's
The handbook, is it?
yes, correct.
That
The
same
mental
handbook.
health, yes,
Okay,
correct.
I will circulate that. All right. So if you have any questions, yes, this digital handbook will be sent to all. And if you have any questions, you can always email Doctor at his email address that was shown earlier, sabbitan@gmail.com. Perhaps you can take a quick screenshot of this and keep it. Be very useful. Because Doctor, after your first talk, we also had people calling me up and asking me, like, because they also went through some situations and stuff, and they were trying to get in touch with you. I believe they did. So thank you so much, Doctor, once again, and thank you to every one of you here today who attended, who took the time to attend this talk.